कर सकते हैं और वो आपको बड़ी सहृदयता से आपको सारी आपकी जो शंकाएं हैं उनका समाधान कर देंगे।
बिल्कुल, डेफिनेटली।
थैंक यू सो मच सर, थैंक यू सो मच फॉर बीइंग सो जनरस टू अस। आपकी ब्लेसिंग्स हमारी बनी रहेंगी हमेशा।
वेलकम सर।
नाउ द नेक्स्ट स्पीकर इज डॉक्टर के वेंगुदुपाथी. He is from Tamil Nadu, and to introduce him, I'll request Dr. Satyamurthy to kindly introduce Dr. K. Vengupathy. Sir, kindly unmute yourself. Kindly unmute yourself. डॉक्टर जैन प्लीज सत्यमूर्ति जी को अनम्यूट कर दीजिए।
Hello. Is it audible?
Yes, sir. You are audible.
Now you are audible. Kindly
Good morning to one and all participants present here to this valuable Zoom meeting. I am proud to be a part of this virtual platform to enrich the knowledge of acupuncture system, and also I will be very thankful to Dr. A.K. Jain and team of this very big, great opportunity to all the integrated systems are coming under one roof. This is only a very effortful man who is a great leader of A.K. Jain and team members only for to achieve this goal. I am very proud of Dr. A.K. Jain for this giving me opportunity to introduce this wonderful session by Dr. Vengupathy. He is a very good auricular therapist. Please enjoy the session. I will introduce a small introduction. After that, you will brighten your brain once again. Dr. Vengupathy is a very familiar in auricular therapy, and also he's done his MSc Yoga, Naturopathy, and also SMP, MD in acupuncture, MACO also, diploma in also in, and also his PG diploma in yoga, naturopathy also. He is now president of Vasantham Acu Care and Health Education Training in Coimbatore, practicing acupuncture since 22 years, and also practicing in auricular therapy 14 years. Teaching auricular in all over India past 6 years. Specialized in height increasing, alcohol smoking, de-irritation, kidney failure, spine alignment, and chakra energy balancing. We are expecting him to bring not only in India, to all over the world. This is our vision. Thank you for giving me this opportunity for introducing the great Dr. Vengupathy. Please, thank you very much. Thank you.
Thank you, sir. Good morning, all. Am I audible? Sir, is my audio is clear?
Yes, sir.
Okay, sir. Thank you. Thank you, Satyamurthy sir, for the great introduction. And I thank A.K. Jain sir for giving me such a wonderful opportunity to share my knowledge in this Acu-Con 2022. And I welcome all the participants who are interested participating in this event to make this as a successful event. the talk which is given to me is auricular therapy. So as usual, when we start, always start the sessions with be blank. Being blank is always very good to get the knowledge as it is from the master. So auricular therapy, we are not going to discuss anything about the Chinese system, which is having a history of 3,000, 4,000 years, etc. We are going to focus only on the system which is developed and designed by Dr. Paul Nogier, who is basically an MBBS doctor who was inspired by acupuncture practice in 1950s. Whenever he is getting patients, he generally used to get many patients with some ear marks. While discussing with the patients, they used to say this is an acupuncture treatment to get treatment for the sciatica pain. So after getting inspired from that treatment, he started to learn ear acupuncture from the practitioner and he started to practice ear acupuncture. After treating 100 and 200 patients, he got some curiosity to know how this strange process, that is a single point in the ear, can treat sciatica. So he started to observe. He started to treat sciatica and acupuncture, and then he started to observe all his patients' ears based on their problems. Whenever he is treating his patients, he generally used to follow all these allopathy procedures. With that, simultaneously, he used to check all the patients' ears and started to mark down the most painful points and started to map all those things. After doing this for more than 5 to 6 years, 1957, while connecting all those points, he get an inverted fetus image. And this is the first inverted fetus image produced by Dr. Paul Nogier, and he launched this image in 1957. And after 1957, he started to take a scientific approach behind what is the things that are happening while we are treating the ears. So whenever we are inserting a needle, what are the technical things that is happening in the brain? He started to design some electrical equipments to track all those things. And he did this research from 1960s to 1985. And in 1985, he submitted all the documents to WHO to say that we have a system by which we can treat more or less all the diseases of the body. So 1950s, late 1950s, WHO formed a few teams to make a research on this therapy. And in 1990s, WHO announced that auricular therapy is probably the most developed and best scientifically documented of all the microsystems. That is the time where he showed a path for all the alternative therapies to prove their systems based on the science. Still that up to 1990s, we don't have an evidential proof, scientific based proof for acupuncture. After showing a path by Paul Nogier, everybody started to prove their systems based on science. So between 1990s to 2000 is the golden period for alternative therapy, because every systems, even acupuncture, sujok, every system, the masters who were all practicing those systems started to prove their systems based on the science. Whenever we are proving our systems with the science, then only people get more knowledge and faith on the systems, and they started to follow the systems. So whenever an egg and sperm union happens, the embryology, the embryo developments, it takes minimum 45 to 48 days for the embryo to develop and get its complete structure, that is, which is of endoderm, ectoderm, and mesoderm. When these 3 layers get complete development, then only the doctor will get the confirmation that this embryo is going to stay in this body for the next 250 days. So that is the time where this embryo gets its complete growth, that is, which is getting the complete state of endoderm, ectoderm, and mesoderm layers. Endoderm, ectoderm, and mesoderm are nothing but the outer, inner, and middle layers of the particular process. So each and every cell of our body is made up of endoderm, ectoderm, and mesoderm. This is how the nerves from the brain travels in the ears. The ectoderm is nothing but the outer layer, mesoderm is middle layer, and endoderm tissues are the inner layers. In ectoderm, the outer layer, the skin, hair, nails, brain, nerves, pituitary gland, pineal gland, sweat glands, teeth, mucous membrane of the nose, and the lens of the eyes. These organs are represented in the lobe and helix tail. In the mesoderm middle layer, we have our skeletal system, blood vessels, bones, cartilage, joints, endocrine glands, heart muscles, urogenital organs, uterus, fallopian tube, and testicles. These organs are represented in the helix, scaphoid fossa, and triangular fossa regions. And then the endoderm, the inner layer, the internal organs, lungs, large intestine, stomach, spleen, heart, small intestine, urinary bladder, kidney, gallbladder, liver, pancreas, tonsils, thyroids, parathyroids, and thymus. These organs are mapped in the inner layer, that is endoderm layer, and these organs are represented in the concha region. Auricular acupuncture is the method to diagnose and treat physical and emotional imbalances of the body. Here is nothing but the switchboard of the brain. So now we are going to see how this acupuncture is scientifically working in our body. So where we have two types of meridians. One is the meridian which is traveling upwards, and the other one is the meridian which is traveling downwards. If it is the meridian which is traveling upwards, this is how the meridian points will travel, and the energy moves like this. So whenever we are having an energy balance, all these acupuncture points are open points by which they keep on receiving some energies from the cosmos, by which they can balance the electromagnetic flow of the body, by which they can maintain a healthy lifestyle and healthy living. So once these channels travels in a proper way, when this electromagnetic flux travels in a proper way, then there will be no disorders or diseases in our body. Once there is any blockage in this point, automatically that particular point will get closed, and the energy flow of this meridian will be stopped from that particular point. If this meridian is having 8 points, let us imagine this is a meridian which is having 8 points, and this meridian have a blockage on this 5th point. Once we have a blockage here, this open point will get closed, and the energy transformation in this meridian will be stopped from here. So the energy will not flow to these particular regions, by which we will get some energy imbalances and disorders of the body based on these points. The purpose of inserting the needle is to remove this blockage. All the needles are metals by which they are naturally conductors. So whenever we are inserting the needle, these needles will receive some electromagnetic flux from the cosmos and transfer the particular energy to that particular point, by which we can remove that blockage. So by which we are again balancing the chi flow. So the meridian and the flow will be like this. Whenever the flow chi flows blocked, then we will used to get some diseases and disorders. By removing this blockage, then the chi flow will be balanced. So we will be getting rid of the energy imbalances or the problems which we faced so far. So we have very many different kinds of points names, like element points, C-cliff point, front move point, back show point, Wang show point, and Leo connect point, and etc. etc. The role of these points are not all the points receive the electromagnetic flux in the same frequency. Each and every point has its different frequencies. So in that particular frequency, the electromagnetic flux will be transferred to that particular points. So by which these points have their own role to receive electromagnetic flux from the cosmos to balance the chi flow. Whereas in auricular point, we generally have all the points which are closed points. And generally all the points will be closed points. Whenever we are getting any problem in a corresponding region, automatically that particular point will get open and started to receive the energies from the cosmos. This is the process called neurogenesis, that is automated process of the brain, by which it can fix all the problems of the brain. Each and every creature in this universe is made up of this neurogenesis, by which they are not getting treated from any other species. Even the birds, dogs, animals, whatever we are having, they are not getting treatment from anybody. They are having the ability to fix all the problems. Like that, our human brain is also designed in such a way by which it can fix all the problems, where we are not connected with the nature as it is. By giving some time and space, we can fix the problems automatically, by which we are not following, we are getting the problem. So auricular therapy is also a neurogenesis process, by which if this will be the normal point, which is the open closed point. Whenever we are getting any problem, automatically that corresponding region point will get open and started to receive the energies from the chiasmas. If there is any problem in the kidney, if let us see if we are having some problems in the kidney and stomach, means automatically the kidney point and stomach point will get open and started to receive the energies from the chiasmas. Once we insert a needle in that particular corresponding region, automatically we are stimulating that particular point and we are giving more electromagnetic flux to that particular point through the needles, by which we are removing the stagnation or whatever the imbalance of the particular body. Once that particular problem is fixed, then automatically that point will get closed, by which we are getting rid of the basic problem of the stomach or kidney. This is how the auricular works. Basically, we are having two types of points. One is open point and another one is closed point. Mostly all the organ points and the corresponding points will be closed points. Whenever we are getting any problem, those points will get automatically open, and by which we are treating, we can close down points. Whereas these endocrine points and chakra points are 24/7 open points, by which they keep on receiving the energies from the chiasmas to balance the energy flow of the body. So whenever we are having various problems, this is very safe that whenever we are handling single problem at a time, whenever we are treating a problem, if the patient is coming with knee pain, liver problem and lungs related issues and inner ear related issues, you just choose which problem has to be fixed first, and treat one problem at a time will give better results. Once if you want to treat the liver point first treat only liver based problems. Once the liver problem is fixed, more or less other points can be fixed by the chi flow of this liver. So always it is safe to treat one problem at a time, and whenever you are diagnosing whenever you are treating the patients, as Dr. Lokia said, just see the patient and diagnose. Without having a proper diagnose and whatever things, you should not treat the patient by symptoms. By only symptoms, if you treat the patients, we cannot fix the problems from the root. So you have to check the pulse and other things to get the root cause of the particular problem. Then only we can fix the problem from the root. We are having various systems of our body. This circulatory system, nervous system, digestive system, respiratory system, etc. The role of these systems to maintain a healthy life. If all these systems works in a proper way, then there will be no issues in our body. Whenever if there is any energy imbalance in these systems, then we used to get some energy imbalances and we used to get some disorders and diseases. That is the time where we need a treatment, which is called a supporting system. The treatment, whatever we are doing, whatever may be the mode of therapy, each and every system is an supporting system. Whatever may be the process, either it can auricular therapy, allopathy, Ayurveda, homeopathy, natural therapy, whatever it is, each and every system has to support your brain. And at the end of the day, your brain is the thing which is going to fix the entire problem of the body. So all these systems, role of these systems is to support your brain to fix the problem. If the systems supports your brain in a proper way, then the problem will be fixed. If it is not supported in a proper way, then we used to get some side effects and imbalances, etc. So each and every system has its merits and demerits. Success of each and every system depends upon the practitioner. The practitioner is the one who is making the system as a successful system or a failure system. Each and every system is basically a successful system, because we are having all these alternative therapies more than 1,000, 2,000 years. So if it is not a quality or valid system, it cannot stand for more than 1,000 years. So we practitioners has a responsibility to make our system as a successful system. If you are 100% clear with what you are doing, then only we have to process, then only we can make it as a successful system. Basically, whenever we are treating a patient, generally we are having lots and lots of doubts about the diseases. First, we have to be very clear about from where the disease starts. Generally, each person usually have one pair of sex chromosomes in each cells. Females have 2 X chromosomes, whereas male have 1 X and Y chromosomes. Both male and female retain one of their mother's X chromosome, and females retain their second X chromosomes from their father. X chromosomes carries the informations about the hereditary diseases. So when a baby is formed, when a couple is planning for a baby, if the male is having 3 problems and the female is having 4 problems when they are planning for a baby, basically this kid is designed with 7 problems. So that is the manufacturing defect of that particular body. So the kid will be designed with 7 basic diseases which will be there in the body from the first breath to the last breath. By the way of living and lifestyle, we can come out of all those problems. Or if we are getting any problems with our lifestyle and other things, means that is 7 plus. So those 7 problems will be there in that particular body. From here only we are getting all the diseases. So basically we should not get too much confused about these diseases. Basically we have 2 kind of diseases. Either it should be an acute disease or an chronic disease as per the TCM. If there is any yang deficiency, it is acute, and if it is any yin deficiency, it is chronic. In this chronic, we have 2 types of diseases. One is structural disease and functional disease. Structural diseases are the diseases can be feel like pain or swelling. That is the diseases which are making a basic structural change of the particular body. And the functional disease is known by measuring the functionality of the particular organ like BP, sugar, thyroid, etc. The diseases which we use to measure with some equipments, those are called functional diseases. So these are all the basic 2 types of diseases. That is all we want to know about the disease. Here the problem is we don't have any treatment for diabetes, BP and other things in acupuncture. Here the problem with the alternative therapists are we are diagnosing the disease with allopathy and trying to fix it with acupuncture. In acupuncture, we don't have any diseases. Here we are having only energy imbalance, the 5-element energy imbalance. So we are getting confusion from the alternative therapy and we are getting confused from our basic system. We should know how to diagnose in our way of therapy. If we are practicing auricular means I have my own design of pulse diagnosis by which I started to diagnose and treat. Like that, each and every system, if Siddha or Ayurveda, homeopathy, we have our own diagnosing systems and we have our own style of treatments. But here what we are doing is we are not following our own traditional methods. We are diagnosing the patients with allopathy procedures and we are trying to give solutions from this alternative therapy. More or less, it also gives results, whereas we don't get a clear picture about what is happening based on our own system. Energy can neither be created nor be destroyed, rather it transfers from one form to another. This is the basic principle of this universe, where we have no creation and destroying, and only it transfers from one form to another. This is the base of Taoism. That is, this is the basic principle of acupuncture, where we have this chi flow. Here we have this energy transformation. For each and every 2 hours, we have this energy transformation. For the first 2 hours, lungs used to receive more energies from the cosmos. That is from 3 to 5. If it is the lungs time, it is not that lungs only will work on that particular time. All other 11 organs will also work on that particular time. Whereas lungs will govern all these 11 organs, because that particular time, lungs has the ability to receive more energies from the cosmos. If it is from 5 to 7, then large intestine have the more ability to receive more energies from the cosmos. Like this, each and every hours, based on these organs receiving capacity of this cosmetic energies, they started to govern this entire body. So this is how the energy flow takes place in our body. So for the first 2 hours, lungs govern this body, and then large intestine, then stomach. This is how for each and every 2 hours, these 12 organs manage this energy flow, chi flow of the body. For the 24 hours, these organs maintains the energy flow. So in this organ clock, we generally always used to have lungs as the first organ. Because whenever we are in the womb, all these 11 organs keep on functioning except lungs. Lungs is the only organ which will not work when we are in the womb. Once we are delivered, then only your lungs starts to work. If it starts its work properly, then only we will have our life. If lungs fails, then there will be no life. That is the reason why we are having lungs as the first organ in this organ clock. Up to this, we are very clear. But the next point is by where we are getting failure from this TCM, because this organ clock is not a common chart. We have to design this organ clock. See here, lungs timing, if 3 to 5 is the lungs timing, means it is not common for all. If my birth time is 9, so I have to design an organ clock for me. So this clock time changes based on my birth time for each and every patient, like as we do in our astrology. It is not common for, if they say today 20th of February will be very good day for all the cancer people, means it will not happen for all the cancer people, because it is not diagnosed based on our birth time. Like that, we have to design this organ clock based on each and every patient's birth time. If my birth time is 9, means 9 to 11, the first 2 hours of my birth, that is the time where I started to inhale. Am I right? First, whenever the baby is born, then it started to inhale, then the chi flow started to get into the body. The outside cosmic energy started to get into the body. So whenever I am inhaling, this energy will get into the body through the nostrils. When we are in the womb, we have completely mucus formed in our lungs region. So whenever the air is getting into the body, this air energy will start to tear the mucus in our body. That is the reason why the kid is crying. Once it keep on crying, this mucus will be get teared and this energy flow will get into the body. So once the lungs gets the sufficient energy to the body, immediately the next process, what the baby will do is, it will pass its stools. A dark green color or black stools will be passed from that particular baby, newborn baby. That is the second process which is taking place in the body. Then once we get an energy from the body, by this first process is detoxing of the body. Once we get detoxed, there is some processes that is taking place in the body, a chemical reaction that is taking in the body, that by which we have an energy drive. So it gets thirst, so it cries for milk, then it takes milk, the milk will get into the stomach, then it will be diagnosed and the energy transformation will be takes process by the spleen. Like this organ clock is designed in such a way how the organs started to work in a newborn baby's body. First lungs, then large intestine, then stomach, spleen, heart, small intestine. Like this, the organs even start to function in our body. Like that, this entire system is designed. So each and every 2 hours, particular organ will govern based on the birth time of the patient. It is not common chart. So we have to, if we want to get a successful result, we have to use the chart based on the birth time of the patient. Like that same, if we follow this chi based energy balancing system, we have some alternations from traditional treatments by which we are treating. We used to consider lungs as the mother of large intestine as the mother of stomach, stomach as the mother of spleen. This is how we are treating. This is how I am practicing my system. So the previous organ which is getting converted to the next organ is considered as the mother of previous organ, by which we are getting a tremendous result. But this is what I am practicing for the past 12 years and giving money back guarantee treatment, by which I am getting a successful result. So whenever we are treating a patient, we must be very clear about what we are doing and how we have to treat the patients. Whenever we are going with auricular, we have all the corresponding regions and all these points which are from all these 12 basic organs and all the corresponding organs. We have the points in the entire ear. We have minimum 200 points, more or less 200 plus points in the ears, by which we can treat and heal the entire problems of the body. So whenever we are treating the needle, whenever we are treating the patients, try to use as minimum as possible. Try to use the needles as minimum as possible, by which we can get and tremendous results. So try to insert the needles as minimum as possible. The purpose of inserting the needle is to channelize the energy flow. Whenever we are having any energy imbalance in that particular point, we will immediately, that particular point will get open and started to receive the energies from the cosmos. So we have to clearly diagnose what is the exact problem in the particular body, either through tongue diagnosis or whatever may be the mode of therapy. I used to diagnose only pulse, by which I am getting an accurate problem, an accurate location where we are having the problems. The main plus point of auricular is we don't need to go for too technical analysis, whether it is in fire axis or water axis, wind axis, XYZ. We have to increase the energy or decrease the energy. We don't have any such complications in this auricular. If we have a problem in stomach, just simply insert a needle in stomach, nothing else, by which we can fix the entire problem, whatever may be the name or terminologies of the point. We don't need to consider about all these processes. Just simply insert a needle in stomach, by which your brain started to diagnose and do all the processes by naturally, by which it has to do. So it is very simple to understand, diagnose and treat. So whenever we are getting a patient, first we have to talk to the patient. First we have to go with the pulse and we have to check their energy imbalances, and we have to start a proper schedule by which we are following. The main success of allopathy is they are following a basic principles by which they are following. They have an uniform schedule and uniform processes. If it is an COVID pandemic situation, if I am going to a nearby clinic to my house, from anywhere, wherever I am going to get these treatments, everywhere this COVID treatment will be safe. By which
kindly summarize, Dr. Vengupathy.
Yeah, it's done. It's done. I'm summarizing. Okay. So whenever we are treating a patient, we must be very clear about what we are doing and how long it has to be. So don't get too confused about the diseases. Basically, to just get whether it is a functional disease or a structural disease, acute or chronic, by which we can get a clear picture, and we don't get too much confusions in this particular process. Whenever we are getting too deeper, we don't get a clear picture. That is the reason why we are not getting any major results in alternative therapies. So, and other most important thing which I have to share, which is not anyhow connected with auricular. This is what happening nowadays. Every kid is wearing a clips in the ears, which is too dangerous for your kid's future. Because whenever we are going to insert, we are going to align these two, it's simply a cosmetic process. There is no health benefits of these doing processes. So once we are going for this clipping processes, basically they used to remove these 4 teeth of this particular kid. So these tooths have a direct connection with liver, gallbladder, eye and testicles, liver, gallbladder, eye and ovaries, and interior pituitary of the body, where we have most gynecological organs and supports. Once we started to remove the patients, which lead them for infertility and impotence. We have come across more than 500 infertile and impotent patients. We have cross-checked them. Those who undergone these clipping processes have major issues in their gynecological process. So I strongly recommend don't go for this clipping processes. Okay, thank you. Thank you so much for such a good opportunity. Thank you so much for AK Jainji and his team to arrange such a wonderful event to spread this acupuncture knowledge.
Thank you so much, Dr. Vengupathy, and you have very peculiar way describe the things by logically, and by collaborating various sciences like chemistry, physics, metaphysics, astrology, even human anatomy and physiology, and how can these be correlated to this auricular science. And let me tell, Dr. K.vengupathy is a renowned expert in increasing the height of a person, and especially kidney diseases. And he is undertaking the treatment on a money-back guarantee basis. So nice to listen you, Dr. K.vengupathy. And your contact number will be given to all our listeners in case they have any problems or any further something to be clarified from you. They'll contact you. Thank you so much. Thank you so much.
Anyone can contact me regarding auricular. Thank you. Thank you so much for it.
Thank you. Thank you. So now coming to our next speaker, he's Sergei Petrovich Fedotov from Vladivostok, Russia. I'm sorry